Ma'am, we are already live, so with all your due permission, can we begin?
Yes, sure, dear.
All right, thank you so much, ma'am. Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, doctor, for today's session. And with great honor and pleasure, I would like to introduce a very renowned gynecologist and obstetrician, Dr. Ritu Santwani, ma'am. She needs no introduction, but it's my pleasure and honor to introduce her at our platform. She is the founder and CEO at 360-degree Healthcare Studio and Sham Well Women Clinic, obstetrician and gynecologist, cosmetologist, and infertility specialist. The topic that we're going to discuss today is non-hormonal management of PCOS. Before moving on to today's session, let us have a brief look on what the topic says. Polycystic ovary syndrome is a hormonal disorder that affects many women of reproductive age. Non-hormonal management of PCOS involves lifestyle modifications, such as regular exercise and a balanced diet to improve insulin sensitivity and maintain a healthy weight, offering potential benefits in symptom management and overall well-being. We'll be learning more about this topic, about the approaches that address underlying metabolic factors and can complement hormonal treatments in managing PCOS. So we have a very eminent speaker whose knowledge is going to definitely help all our viewers. So now, without any further delay, I would like to welcome the very renowned Dr. Ritu Santwani, ma'am, at our forum. Ma'am, over to you.
Yeah. Thank you, Batul, and thank you, IGCP MedTalks, for inviting me here. And warm welcome to all dear friends who have joined all across the geography. So friends, today I'm going to discuss a very important topic regarding the non-hormonal management of the PCOS. As just now Batul has given the brief description about the PCOS. So we all know that daily in our OPD, we are getting a lot of patients related to this PCOS. From adolescence up to the menopause, lot of patients are coming. So I can say, in the other word, the PCOS is also known as a thief of womanhood. So a lot of patients are coming to us and telling, madam, till we are taking the hormones treatment, we are better. Once, as soon as I stop the hormones, my periods again become irregular. So I don't want to take the treatment. Earlier, doctor had given me 3 months treatment. Some has given me 6 months treatment. And other, sometimes when the young girls are coming, adolescent girls are coming with their moms are telling us, madam, please don't give any contraceptive pills, don't give any hormones. So there is a lot of phobia in the everybody's mind. So we all know about the hormonal treatment. Today my talk will be focused on the non-hormonal treatment. Yes, as Batul has also mentioned, yes, the lifestyle modification is the key in the treatment of the PCOS. Besides this non-hormonal, what medicines we can give? Lot of medicines have come these days. Daily in our OPD, different company representatives are coming and meeting us. Madam, you can start writing this, you can start writing this. But what the evidence says, so which nutraceutical we can give and which is beneficial for our patient, I'm going to discuss that with you all today. Post my presentation, we can discuss some of the non-hormonal practices for the management of the PCOS, what you are doing, so we can exchange our knowledge. So now coming to the topic, I am sharing my screen. Those who are not connected with me on any social media, friends, I am on all the social medias, Facebook, LinkedIn, Instagram, and YouTube. So you can connect with me on there. And I'm keep on doing a lot of academic programs for the sharing of the knowledge. So we all can be benefited by the mutual sharing of the knowledge. So yeah. My all presentations will always start with Mata Durga Stuti. Just a second, yeah. या देवी सर्वभूतेषु चिकित्सा रूपेण संस्थिता नमस्तस्यै 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 नमो नमः. So today we are going to discuss, as I just told, the non-hormonal treatment of the management for the PCOS. We all know that this PCOS, we can say, for the woman's health, the unseen threat. So PCOS is a complex condition PCOS is a metabolic syndrome with reproductive implications, huge impact on the reproductive, metabolic, and cardiovascular health of affected girls and women. It is known as also as a thief of womanhood. So we all know the patients presents with polycystic ovaries, irregular menstrual cycles, hyperandrogenism, hirsutism, acne, and the infertility too. So now we are coming to the topic. So we all know, friends, the PCOS prevalence in India, around 36% of the women in India are suffering from PCOS. This data has been presented in 2019 by the Reproductive Contraceptive Journal, and infertility affects 40% of the women with PCOS, and approximately 90 to 95% of the patients are having the anovulatory women presenting to the infertility clinics are having the PCOS. These days, lot of awareness on the social media. So many girls are coming, madam, we have seen this reel, we have seen that in the Insta or in the Facebook. So we all are aware that we are suffering from the PCOS. So what is in this basic pathophysiology? As we all know, the LH-FSH ratio is disturbed. LH is more than FSH, and low FSH causes the poor growth and development of follicles, no formation of egg and ovulation, and high LH produces the androgen. Androgen causes the weight gain, acne, growth of facial hairs, and insulin resistance. So we all know in the PCOS, the insulin resistance is the main problem. So it is a basic pathophysiological contributor in 50 to 80% of the PCOS women. So this insulin resistance causes the hyperinsulinemia, which causes the early response to LH on the granulosa cells in small follicles, premature differentiation of granulosa cells, which in turn causes the anovulation. This hyperinsulinemia causes the stimulation to theca cells, increasing secretion of androgens, persistent hyperestrogen, elevated LH, and of course we know because of this increased androgen, it causes the virilization, low sex hormone binding globulin, decreased SHBG, increased testosterone, hyperandrogenism, hirsutism, and acne. So this PCOS causes the etiology, the multifactorial etiology, the genetics, obesity, sedentary lifestyle, environmental growth factors, which in turn causes the ovarian dysfunction, dysregulated HPG axis, and insulin resistance, due to which all excess androgen, these all symptoms are presenting. So now, friends, coming to the management. As my talk time is 30 minutes, I will try to finish off in that. So we all know for the PCOS treatment is the word M is very important. We all know earlier we are using the metformin. Now later on we started using the miracle pill, the myonisitol. Because with the metformin also, see, everybody has a different experience. But usually the patients are having some patients are having the gastritis, acidity with metformin, and moreover, once we write the patient the metformin, once they go for the purchasing this tablet, lot of chemists are telling them, are you suffering from the diabetes? Why you are taking this medicines? So metformin is being used in PCOS since 1994 for reducing the insulin resistance. And metformin is used in the dose of 1500 to 2000 mg per day. The GI symptoms and its main side effects includes the nausea, vomiting, diarrhea, and flatulence. So studies have come that whether is it effective or not. So friends, yes, earlier when I passed out 24 years back, yes, of course, in our residency also we are giving this metformin. But now what the recent studies have shown. So from the Cochrane database, the studies have come that this metformin does not improve the ovulation and pregnancy rate or live birth. Yes, of course, there are two schools of thoughts. One is still in the favor of the metformin, but somehow I am very much convinced with this myonisitol and D-chironisitol, and my patients are also getting a very good results. I am using this drug. So this drug, myo and D-chironisitol therapy, in the physiological plasma ratio 40:1 should be considered as the first-line therapy in PCOS. So this myo and D-carboxyl significance, as we know, this DCI reduces the peripheral hyperinsulinemia, while this myo-inositol improves the ovulatory function. Combined therapy with MI and DCI in physiological plasma ratio 40:1 seems to be the most appropriate clinically. So we all know the myo-inositol acts at ovary, while D-carboxyl acts at the peripheral tissues. Myo-inositol increases glucose cell intake, while DCI increases the insulin sensitivity. Myo normalizes the LH-FSH ratio, while DCI reduces the hyperandrogenism. Myo increases the oocyte quality, and DCI stimulates the glycogen synthesis. So friends, here we can see how both of these are acting and how the synchrony of this giving the good results in the PCOS treatment. So there are a lot of clinical trials has been reported of this drug. So they have shown that how this, by giving this combination, significantly decreased in the fasting glucose and fasting insulin levels. Again, these studies have shown by giving this combination, it decreases the insulin resistance and decreases the testosterone levels. So this will be the drug of choice, especially in the patients of the overweight patients. Now the question comes that whether we can use this drug in lean thin PCOS or no. Yes, we can use this. This is not like that if the patient is lean thin PCOS. So in that patients also the lifestyle modification is also very important. So we have to explain them also for the lifestyle modification. In the combined therapy of this myo-inositol and D-carboxyl, studies have come that it can improve the IVF results also. This study has been presented in Archives of Gynec and Obstetric Journal. They have shown that it gives the good results in all the points: oocyte quality, embryo quality, fertilization rate, and pregnancy rate. Then studies have shown that it by using this, the significantly reduce our FSH requirement, 17% reduction in our FSH. So a lot of studies in the favor of this. Then other drug which has come is the berberine. Lot of studies have come for this also. Some companies have manufactured the combination of these two, and some are giving this drug as separately also. So we all know, friends, for this berberine in PCOS, how it is acting. It increases the insulin receptor expression, increase binding of insulin to insulin receptors, increases the insulin sensitivity. Then here we can see which in turn intracellular increase intracellular AMPK activity, increase translocation of GLUT4, and then increases the glucose uptake. So this is the one slide in the nutshell that how this is acting and how it is helping. This is also a detailed study that how this drug is acting. So there are a lot of studies and a lot of trials in the favor of this also. The studies have shown that by using this drug, and usually in the combination of myo and D-carbo, it's usually affecting in all the parameters here. Friends, we can see all the endpoints: the waist circumference, waist hip ratio, HOMA, insulin resistance, total cholesterol, LDL, HDL, and SHBG. Yes, of course, minimum of the 3 months. So these all parameters will be getting benefited by this. So this study has concluded, I can take these 2 lines which are very important. So it improves the insulin sensitivity and stimulates the glucose uptake via activation of the AMP activated protein kinase pathway. So these studies have shown, there is one more study has been presented in the Journal of Clinical Endocrinology, that in the dosage of, they have done the trial in the approximately 150 patients, infertility women who are undergoing IVF treatment. In the 50 patients, they had given the 500 mg of the berberine thrice daily, while in 50 patients, the 500 mg of the metformin, while in other 50 patients, only the placebo. So they have found the good results with this. So they have the studies have shown that this drug is giving a significantly good result in decreasing the insulin resistance and decreases the fasting blood glucose level within 12 weeks. So these parameters already have shown. So studies have shown that it has a more therapeutic effect and achieve more live births with fewer side effects. So a lot of studies, more and more studies has been presented in the favor of this. This was actually yeah. So then coming to as today we are discussing this non-hormonal, the another is very important is the L-methylfolate. We all know, yes, we all are giving the patients who are coming to us for the preconceptional treatment. Yes, we are giving this PCOS. So studies have shown the folic acid deficiency, low L-methyl tetrahydrofolate, hyperhomocystinemia, and development of insulin resistance. So friends, as we all know, in hyperhomocystinemia in approximately 88.1% of the patients of PCOS. So patients, females with PCOS, a strong association between the serum homocysteine and insulin resistance. Then thus this drug is acting, decreases homocysteine, decreases insulin resistance, and decreases the PCOS. Then of course the vitamin D, we all know friends that vitamin D, lot of studies have come that vitamin D is in the implication of the everything etiology. Yes, so instead of not giving of vitamin D is a good option. Vitamin D deficiency decreases sex hormone binding globulin, increases androgen action, obesity, increases insulin resistance, inflammation, and metabolic syndrome. Then we all know this also acts on all the parameters of this. Lot of studies have come. Now the another trace element which has been reported is the chromium. So we all know the chromium improves the insulin sensitivity and reduces the hyperandrogenism. Studies have come for the chromium picolinate reduces the insulin resistance in PCOS. A lot of studies have come that it improves the ovulation rate and pregnancy rate. So it is actually very difficult to give this all things separately. So there are a lot of combinations are available, so we can use that. So this chromium picolinate significantly increases the chances of ovulation and regular menstruation by almost twofold. So it also helps to reduce the insulin resistance and stimulate the ovulation. So there are a lot of studies have come for the comparison of metformin versus chromium picolinate in CC resistant patients with PCOS. So they all have shown the that it is better tolerated and while no significant difference in the group with the ovulation and pregnancy rate. Then coming to the another component is the melatonin, because there are a lot of nutraceuticals for the non-hormonal treatment. So the melatonin. So friends, we all know, yes, melatonin stress is, we all know, a very important factor in the PCOS management. So yes, we are giving a lot of studies has come regarding the use of this melatonin, that it improves the ovulation, ovarian function and oocyte quality. Especially I am using this drug very frequently in the patients who are coming to us for the infertility treatment. So a lot of studies have come regarding the benefits of this drug. So studies have come that the melatonin and myo and D-chirosterol synergistically enhances the oocyte and embryo quality. So lot of studies and lot of different components, different products has been available these days. It's the combination of these. This we have already discussed. Now, coming to the very important part, yes, for the last, I need 5-6 minutes more, that the lifestyle modification is also a very, very important in the PCOS management. We all know weight loss is one of the cornerstone to achieve a healthy pregnancy and childbirth. So I think all of us have seen this slide. so many times that whenever the patient is approaching us with the PCOS, yes, we always tell that the weight reduction, at least you come with the 5% of the weight reduction in our next visit. So because drastic weight reduction is not possible, the patient has to come with the some weight loss. Even the 5% of the weight loss will help in the getting back to the from anovulation to ovulation and regularizing her menstrual cycle. So we all know the lifestyle has been changed. Earlier, when there was no remote, usually everyone goes and whatever the channel they want to change or increase the sound or decrease the sound or the picture quality or the brightness. But so earlier the TV was like that, and now as the advancement has done, so the TV becomes slim, sleek models has come, and we are becoming fat day by day. So lifestyle plays a very, very important role. So here you can see that how instead of cakes and pastries, the carrots are good and fresh fruits and vegetables are good, how it will help in the reduction of the weight. So weight loss is the, there are some tips we give for the PCOS women. Yes, for all the patients, as we know, having the insulin resistance. So the low glycemic diets will be the good. Eating a low GI, low carb diet may reduce the insulin levels in women with PCOS, which will help in the weight loss. Because the topic is so vast, I can take some important slides for this. Otherwise, for the there can be one separate lecture for the diet in the PCOS patients. So we always advise the patients to have a stuff with the low glycemic index. So here you can see, friends, the low glycemic index less than 55, medium 56 to 69, and high is more than 70. So what whatever is coming in the low glycemic index, we advise that usually we can see the broccoli, celery, cucumber, lettuce, peppers, spinach. These all are having the less calories. So we always tell the patients to take this. Or one simple I can say means I usually tell my patients to take less salt, less oil, and less sugar. So these all three are very bad. So you can see, all of you can enjoy this humorous video.
मैं जाती हूँ वहीं चले आते हो, चोरी चोरी मेरे दिल में समाते हो, ये तो बताओ कि तुम मेरे कौन हो। जहाँ मैं जाती हूँ वहीं चले आते हो, जहाँ मैं जाती हूँ वहीं चले आते हो, चोरी चोरी मेरे दिल में समाते हो, ये तो बताओ कि तुम जहाँ मैं जाती हूँ वहीं चले आते हो।
So whenever the patient or the girl, once we tell them to go for the diet, so of course, first and foremost, very important should be a company of the friends, those who are also are very diet conscious and weight conscious, not like that कि नहीं तुम एक दिन तो खा लो खाना, एक दिन खाने से क्या होता है, कुछ नहीं होता है. So that is also very important. There is one more video.
मुझे पिज़्ज़ा भी पड़ा, मुझे चाउमीन पुकारे, मुझे मोमोज पुकारी, आजा गोलगप्पे बोले एक प्लेट तो खा जा, मोटा मोटा समोसा, पीछे पिज़्ज़ा भी पड़ा, मुझे चाउमीन पुकारे, मुझे मोमोज पुकारी, पीछे पिज़्ज़ा भी पड़ा, मुझे.
So, of course, once we advise the patient for this weight loss, so yes, the high fiber diet will be definitely going to help her. And of course, as I told, the fresh green leafy vegetables and all the food stuff of the low glycemic index, we always advise the patient to avoid for the processed foods, like the chocolates, cakes, pastries, instant soups, ice creams, the meal replacement shakes, that all are just not good. And the soda diet, which is containing the high sugars. And here also I want to emphasize, because most of the girls who are coming to me, madam, we are taking the without calories, we are taking the 0-calorie soft drinks. But friends, we have to also explain to our patient that all that are very high in the caffeine. So we have to explain them. So yes, of course, the lifestyle modification is the key. Running, jogging, exercise, we all know. Of course, yoga that is from our Indian culture. Yes, yoga is also very important and will be helpful. Yeah. And as the patient, as I'm being an infertility specialist, a lot of patients are coming for the infertility treatment. So we always advise that any kind of the exercise is very good for that. So, and for the young girls also, yes, dancing, aerobics, jumping, skipping, jogging, anything will be good. So yes, this is for the infertility, what we always tell the patients. Yes. Yes, and avoidance of this smoking, because these days a lot of girls are coming to me, yes, addicted to the smoking and alcohol. So besides that, that's the three important S for the PCOS management. Yes, the stress management, good quality of sleep, and the proper supplementation is also important. So we all know that lack of the sleep increases the activity of the hormones that drive hunger, such as cortisol, which causes to eat more throughout the day. And insufficient sleep is also associated with higher risk of being overweight or obese. And stress is also a risk factor for the weight gain. Chronically high cortisol levels are linked to insulin resistance and weight gain. So the carry home messages is the PCOD treatment is a challenge. Best therapy should include a 360-degree approach to the problem, taking into the consideration the complexity of the syndrome. So here we can see, friends. So just a second. So the treatment should be address the root cause. The slide is not moving. Yeah. So all the studies have shown, the European Review for the Medical and Pharmacological Sciences, the combined therapy may be the first line approach in the overweight PCOS. So thank you, friends, for your attention and your time. I tried to sum up in the given time of the 30 minutes, though the topic is very vast. I will just stop sharing. Yeah. The topic is very vast. I have to include lot of things. So we all know the hormonal treatment we are giving, the different combinations of the OCPs, that itself is a big lecture, and the non-hormonal also, the lot of things are there. I tried to include as much as possible. So thank you once again for your interest and your time.
Thank you so much, ma'am. Thank you for such wonderful inputs that you have shared upon this topic, and you have enlightened everybody with your knowledge. Thank you so much for that. We have received a few questions from the viewers. I would like to put it across to you, ma'am.
Yeah.
The first question is, which medications in the drug class hypoglycemic agents are used in the treatment of polycystic ovarian syndrome?
Yeah, we are using only some doctors are using only the metformin, or I'm actually not using even the metformin. I am very happy with this myoinositol and D-chironositol. So that's why I presented the comparison slide also, that how that it is acting. Otherwise, you can, if you are comfortable and you are getting your patient get be properly monitored, you can use with this metformin also.
Thank you so much, ma'am, for answering this question. We'll move to the next question. And the next question is, what is the risk for breast or ovarian cancer in patients with PCOS?
Yes, this is a very, very good question. Yes, the studies have shown the patients of the PCOS having a more risk of the endometrial cancer compared to the breast and ovarian cancer. This question has been asked by so many patients also. See what happens. We always tell to the patients, yes, you have to treat your PCOS properly. So sometimes the patients are coming to us, yes, madam, we have taken the infertility treatment, and after taking the infertility treatment, I have conceived and I have delivered the baby family also. So now why it is important to take the further treatment? Now my family is complete these days. Everybody is happy with 1 or 2 kids. Now I don't want to take the more treatment. So friends, the studies have shown, yes, of course, if there is no every month bleeding, not so of course the endometrial thickness will goes on increasing in the thickness. So the chances, the risk of the PCOS patients having a more risk of the endometrial carcinoma compared to the breast and ovarian carcinoma. There have some studies, very few studies have come now in the favor of that, but all the studies are supporting for the more risk about the endometrial carcinoma, that is for the uterine cancer. Yes, but you can take next question.
Thank you, ma'am. Thank you for answering it in such a brief manner and letting our viewers clear their doubts. Thank you so much. We'll move to the next question. And the next question is, what are the ACOG recommendations for diabetes screening in women with PCOS?
That I will take separate lecture. That is a big lecture for the ACOG and diabetes. Yeah.
So I'll request the viewer to present this question again in the next topic when we'll be having this particular topic.
Yeah.
So we'll move to the next question. And the next question is, which manifestations of hyperandrogenism suggest PCOS?
Oh, wow. This is a good question. Yeah. See, the lot of manifestations of the any kind of the hyperandrogenism whenever the patient is coming to us. Yes, the patient is coming to us with the increased hair growth on the upper lip or near the navel, or if the blackening of the skin, we all know in the nape of the neck or in the axilla. This all denotes the testosterone levels are high. And yes, as the viewer has asked the question that how it is showing the PCOS. So we can't say only by this for each and every patient. Says we have to do in some, of course, depending on the patient age group and what. In every patient we are not going to do this HOMA index and all that things, but these some symptoms if are present on the patients, yes, and if the weight of the patient is towards the higher obese patients, yes, these all symptoms denotes that patient is towards the PCOS or the irregular cycles, hirsutism, and some patients are presenting with the this. I'm getting disturbed, 1 minute. So, and if the patients are getting the hair fall from the scalp, alopecia, these are the some symptoms which definitely goes in the favor of the PCOS. But now, Batul, I want to share one report because this is in this era, most of the patients are coming to us with the sonography report directly. Madam, I had gone to the one doctor for the UTI, there was a urine infection, and doctor told me to do the sonography. At that time, I was detected by the polycystic ovaries. I am having no symptoms. So a lot of the patients are coming to us with the sonography report directly, which is showing the PCOS. So these are the some symptoms which definitely denotes that the serum testosterone level is high and patient is going towards this PCOS. And once you want to differentiate from this, that the patient is having any adrenal gland tumor or patient is having the PCOS, then definitely we have to go for the battery of tests. So if you are very much interested, you can go through my YouTube channel. I have already posted a lot of lecture in the detail for this.
Thank you so much, ma'am. Thank you for answering all the questions. That was the last question for today's session. And I would like to thank all the viewers for their ardent participation and putting up such interesting questions for today's talk. So thank you so much to all the viewers as well. And I would like to thank you, ma'am, for taking out your valuable time and putting up so much of efforts in presenting up this presentation with your enlightening talk and the talk that you have delivered on our platform. So thank you so much for that. Every time we are keen to have you at our platform and to hear out from you. So it's a pleasure to have you here and an honor at the same time to share the same platform with you. So thank you so much, ma'am. With all your last comment, we can conclude the session here for today, ma'am.
I believe only in one funda that knowledge always increases by sharing. So whosoever invites me, I am on so many platforms. So I don't want to say no to anyone. So, but that is only the time consistency. I have to manage the time. So I want to say everyone that yes, knowledge, sharing of the knowledge is the new mantra in this digital era. So keep on sharing the knowledge. Knowledge always increases by sharing.
Thank you so much, ma'am, for such a valuable comment and such a valuable feedback that you have portrayed. Thank you so much for that.
Okay, dear.
So
bye
with
bye.
this,
Thank you.
We are concluding the session here for today, ma'am. Thank you.
Bye, dear. Thank you.